I was struck with a patient. 4 days before I was clinic, I was सोपोर का एक patient था. उन दिनों meningitis बहुत common होता था, and meningococcal meningitis. As a resident, when I went first day, I saw a man from Sopor. He was admitted as SMHS, young boy. They would not come because they would say, "You get the infection, you die."
अच्छा.
If you take Kashmiri tea and boil it and go on boiling it and put salt, it gives you 2 carcinogens were identified in extraordinary high levels.
केआरएस के एक नए पॉडकास्ट में मैं आपका वेलकम करता हूं। आज जो शख्सियत मेरे पास मौजूद है वो डॉक्टर खुरू है, डॉक्टर मोहम्मद सुल्तान खुरू, जो एक रिनाउंड गैस्ट्रोएंटरोलॉजिस्ट हैं। सर, अब मैं आपका वेलकम करता हूं इस पॉडकास्ट में।
शुक्रिया इश्तियाक साहब, आपने मुझे यहाँ बुलाया। थैंक यू वेरी मच फॉर दैट
सर,
आपकी प्लेजर फॉर मी टू बी हियर।
आपकी जो इनक्रेडिबल जर्नी रही है, आप एक साइंटिस्ट भी है, आप एक जाने माने डॉक्टर हैं। अपनी जर्नी के बारे में मुझे और मेरे सामीन को बताइए।
Well, journey starts with your childhood and where from your roots are. I belong to Sopor. That's where I spent my childhood, my primary education, and also schooling and up to college. That was the first part of anybody's career. Then I went to Medical College, Srinagar. I was in the third batch, in the Government Medical College, Srinagar. I was in the third batch. There were three batch before, probably third or fourth batch I was there. So we passed from Medical College, Srinagar for an MBBS. After doing MBBS, I was in that era was where we had to do residency. So I did residency for a few years to really train how to practice medicine. And I did medicine, dermatology, psychiatry, and emergency medicine. 4 areas I covered as a resident. Then उसके बाद MD medicine उदित medical college में ही किया. So after doing MD medicine, I went into the faculty of the medical college. Lecturer बन गया Department of Medicine में. But after 2 years, I was a bit restless. I thought it was not the right way to move. So I nearly resigned and went to PGI Chandigarh I went for cardiology, but fate accomplished, I had to start gastroenterology. Although my interest and I was selected for cardiology, but because of several things, I started gastroenterology. So gastroenterology finished karke, I came back.
Okay.
Although there was a chance that I could stay back in PGI, but I chose to come back. I went back to the medical college, Srinagar. But that was till 82. Then 82, I joined the Sher Kashmir Institute of Medical Sciences. There I spent 1.5 decades. That was the most productive. In the medical college, after coming from PGI, then institute, they were very productive and very, I would say, absorbing and very innovative time. And that time, medicine was also moving fast. So then we were unfortunately hit by the circumstances. But I took over the director of the institute in 1993 and stayed till 96. After that, I went to Middle East. I went to King Faisal Specialist Hospital, Riyadh, which is probably the apical center in the world about medicine. There we started. Although I went as a consultant there, but I took over the head of gastroenterology, liver, and liver transplant.
Great.
So I stayed there 10 years. So after 10 years, I came back. And now I'm back here for at least several years. So we're running a tertiary clinic which is dedicated to gastroenterology and liver. So this is the path, if you say that ये रास्ता ऐसे चला.
हाँ, ये it's an incredible journey actually. If we look at your career, sir, कोई ऐसा moment जो आपको आज भी यादगार है इस पूरे करियर में जो आपने अपने अंजाम दिया है, कोई ऐसा मोमेंट हमारे सामीन को या मेरे साथ शेयर करेंगे जो आपको यादगार है इस पूरी जर्नी में?
You know, in life, several things are which make an impact. Several things which make an impact, and for different reasons. Some for your convictions, important, of how you spend your life. Some for practice of medicine, some for patients, some for research, and some for your career. But I think the impact for your conviction is my father, late Haji Abdurrahim Khuroo. He was not only my father, he was my friend. I mean, probably anytime I would go to Sopor, I would stay with him till 2 a.m. in the morning, 3 a.m. in the morning, because I had to catch up next morning at 8 o'clock for my journey. But I would sit with him, talk to him, understand life, understand what is hard work, what is honesty, what is morality, and what is ethics. I think ethics is, I don't know whether people understand ethics kya hota hai, but I think he understood it very well. And so there was a lot of discussion between him and me, and mostly it was his advisory role into my career. I think that made a major impact, and he was very convinced. He was convinced that if we want to become a doctor, first thing is hard work, service, just for service to the patients, and because patient is the most important, and service to your own people. That's important. It's not that you go to US and do service there. It's easy to do it, or go to Middle East, or go anywhere, but service to our own people. And then very important, what was that he understood Quran very well. He had in-depth information about Persian. He had a Persian, at that time it was the Persian, and he understood Quran and understood all what it meant. He said, you never leave what you learn, keep it with yourself. Give to the next person. So that was a role, first as a role as a doctor, second role as a teacher. And then he said, you must not stop identifying anything which is unknown. And I think this word came from him, to explore the unknown came from him, that you must put your life in to explore what is not known. But it's what God has kept so many secrets which are not known. And so I think in my convictions, that was the most important period which I spent with my father. Apart from that, as a physician, I think the role probably, there wasn't anybody who really, as a physician, who was of this nature as my father was, because he had already given me as a role as a physician, as a teacher, and as a researcher. That was the role. And you have to be, very importantly, hardworking. A doctor has to have few things which are very important. First thing is, we have to understand, for a doctor, you are from your own culture, but then you're the person of you deal with everybody.
सही
I've dealt with the king of Saudi Arabia.
एग्जैक्टली
I've dealt with the queen. I've dealt with all the family members.
बिल्कुल
I've dealt with the chief ministers here.
हम्म
I've dealt with MLAs, MPs. I've dealt with the common people. I've dealt with that downtrodden person who's from Kupwara or Gurez or this thing.
हम्म
So when you have a thing like that, you have to build in self a character that you can deal with all this group people,
यस एग्जैक्टली
and it should be with respect and dignity.
हम्म
So you give the same dignity and respect to a person of Kupwara who may not have few chips in his pocket to the person who is the king of a country or a chief minister of a state
सही
or maybe anybody.
हम्म
So that is number one, which a doctor has to do. Second thing is you have to have time for people. You cannot hurry. If somebody comes to you and looks for he always has an impression that there's something wrong with me.
बिल्कुल
And there are some people also who say, I might die, I might have a serious illness, whatever illness is. So that, and to get that feeling out of a person who is sick, you have to have time, you have to have patience, and you have to have understanding. So to be a doctor is a blessing. So you have to do that to make the person. People might have somebody advanced cancer. Well, that is normal. But many people come up with all the apprehensions. So that's important. Understand the family, understand the patient. Other than disease, what you treat. So this is also another thing which probably a doctor has to have, and he has to have time. He must not. He must be, a time schedule must be there. अगर आपको 10 बजे कहीं जाना है और किसी पेशेंट को देखना है, you have to be there at 10. Can't be that somebody is waiting for you because we gave an appointment that you come at 12. You just go for
बस सर सॉरी टू डिस्टर्ब यू ये सिस्टम तो हमारे यहाँ अब है नहीं जो आप कह रहे हैं कि टाइमिंग
No, I had it in myself. In institute, I stayed there 16 years. There is never a day when I was not there at 8 in the morning. You can just, it was to the dot. I never stayed, although the institute started at 10, I was there at 8. And then when we come back, we never knew. 10 o'clock in the evening, 12 o'clock, sometimes 2 in the morning, sometimes don't come at
but
all.
unfortunately it's not happening these days actually.
Well,
But that's what I mean to say.
You see, I'm saying that how somebody's life gets involved. Doctors very, 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 very hard. You would see. I don't think it is. You would say it is not. It's happening. जैसे कभी a doctor goes to the hospital. Let's say he goes to medical college or to hospital. He works in the clinic in the morning. Then whole day he is in the hospital. Then in the afternoon he is in the again in the clinic. And then after the clinic, if I would say in the Sopor जब मैं practice करता था, at 9 o'clock I would take a taxi or a tanga and go to a next, जैसे जहाँ पर आप रहते हैं, I would go and see patients. So this is every doctor is doing it. I don't think I was the only single. You are not seeing it. The public is, earlier doctors were called as gods, next to gods. Now the person will change, but all doctors work very hard. This is one profession where the person himself works hard. And he works from morning. Most of the people go to the clinic at 6 in the morning or 7. And they come back home from clinic back at about 10, 11. The only problem, public doesn't see it, but they do it. Like in the clinic, in the institute, I would go at 8 o'clock. But, the other doctors would come at 9, 9:30, 10. That's okay. But this is what I had built up. Be there at 8 o'clock. I would be there at 8 o'clock. Uh, but I think I would not say that it is not happening. Then patient as a primary responsibility teaching, it happens. But in a society where there are thousands of people, thousands of attitudes, thousands of convictions, the uniformity will not happen. हर एक ही रास्ते पर नहीं जाएगा. People have different. Some people are on edge. Some people are in the middle. Some people are on this side. Some people work extraordinarily hard. Some people are in the middle, and some people don't work. That happens in each society.
सर आपके कैरियर में ऐसा कोई पेशेंट आपने देखा हो जो वाकई में, या कोई सर्जरी आपकी ऐसी हुई हो जो चैलेंज आपको लगा होगा अपने पूरे कैरियर में?
Several. There have been patients here every day in the evening. We write that's not only here. Every day in my life, I write a note. What was there which struck us today?
अच्छा, शाम को
Even,
आते, हाँ सही.
even today also. Yesterday when I was in the clinic, I always ask the staff, what struck today? We sit down together. What struck today? If you say story, 2 days back when I run the clinic, I was struck with a patient. 4 days before I ran the clinic, and this is not happening now. This is happening right from the time I started my practice. Even when I was a resident, I would write my notes. Today I had a meningococcal meningitis. I remember one story of when I was a resident. सोपोर का एक पेशेंट था. उन दिनों meningitis बहुत common होता था, and meningococcal meningitis. And now it is controlled because you use the vaccine. जैसे आप हज को जाते हैं, you have to use a vaccine. That's for meningococcal, one vaccine. But that time vaccine was not available. So this disease was very common. And a lot of people, and as a resident when I went first day, I saw a man from Sopor. He was admitted SMHS, a young boy, distantly known to me, and a family whom I knew. So I did a lumbar puncture. It was meningitis. Achha. So I was struck, and then we put him on penicillin. He was nearly dying because Achha. Meningitis is not ordinary illness. You get infection of the meninges you have, and there's pus there. In about 10 days, he walked out. So it strikes you, you can diagnose this. And I did it as a resident. These days, every day, if you give me every day a story, I can tell you 2 days, months back what I saw, or even 2 days back what struck me. Like I'll tell you, 2 days back there was a boy, 14 years boy, just a story, completely messed up. He had obstruction, plain X-ray show obstruction. That means his bowel is obstructed. He has gone, his mother is with him because the father cannot go because he's a laborer. He has gone to every place in Kashmir. जहाँ जो भी देखे वहाँ गए. And nothing done. Now we picked this patient. We knew what it is. He's got a TB of the gut. And we picked an ultrasound. Although he had CT done, ultrasounds done.
Everything was done actually.
X-rays done. He was in the institute admitted for some time. He was in the SMHS also with pediatrics. We picked him up. This is something remarkable. It makes you a lot of impact in your practice. So every day in your practice, if your practice is not rewarding, it is not practice. अगर आप रूटीन करते हो, बैक एक को ये लिखो, लेग पेन को ये लिखो, हेड एक को ये लिखो, that's not medicine.
That's not
medicine. Is that you try to understand somebody's disease and try to deliver, which probably your colleagues might have missed or may not have given full attention, or may have been at a time when he was not available to him. And every day, practically every clinic, we see 1 or 2 patients just right. Achha. And while we feel that, oh, this is, like I started from residency, so when I was a young doctor, and 2 days back I told you this story. You can see all these years we have been seeing this sort of thing. So there's this.
सर हेपेटाइटिस ई के बारे में पूछना चाहूँगा। मैं एक इंटरव्यू आपका देख रहा था, जहाँ आपने वो एक जर्नी बताई थी कि जब मैंने वो डिस्कवर किया, सोपोर के इलाके में मैंने रिसर्च की, मैं डॉक्टर मेरे साथ नहीं आते थे, कोई अवेलेबल नहीं होता था, लेकिन आप कम नहीं हुए, आपने कंटिन्यू वो रिसर्च की और आपने डिस्कवर किया। बताइए मेरे सामिन को कि ये कहानी क्या है पूरी?
कहानी तो ये है कि when I came back from Chandigarh, I think it was an eye opener. I would not say that Chandigarh में किसी ने मुझे कोई the way my father gave an inspiration, he gave an inspiration of an life sort of how to step your life through. I don't think there was any inspiration from the PGI, although they were very great doctors like Dr. Tani, Dr. Datta, Dr. Mehta. They were very good, excellent physicians. But nobody gave me such impact what my father had, because I had long association with him for so many years. But what struck me there is that hepatitis is something which is not understood in India, and it is being we are being cheated by the West. People are telling us, "Oh, what you are doing, nothing. You are talking these data. They are of no consequence. They are from hospital. ये data कुछ फजूल है." So I said, well, I came back with the idea. Not that I came back with this idea, but it just struck me that but when I came in 78 November, there was a huge epidemic which came in Sopore.
Exactly.
But what happened, you were saying that nobody came.
Yes.
It's just like COVID. It was worse than COVID. But COVID was obviously a pandemic, but this was an epidemic. This was not a pandemic. COVID was on all the countries in the world, and everybody got involved. But here it was about 200 villages, and every doctor who was from outside that area,
they don't want to come.
No, but they would not come because they would say, you get the infection, you'll die.
अच्छा.
और मुझे भी घर वालों ने बोला कि are you sure you want to go to this thing, because I got hepatitis. Everybody had to get it because like COVID में how many doctors died? Hundreds of doctors died who were with the patient, they died. So nobody was coming, and that time the scare was so much. But COVID में the government did one thing, they put in a lot of efforts for the doctors to really work. But उस वक्त तो नहीं था वो. But I went and I took the local staff and we worked. Now, because these were not hospital data, these were no field data, because we went from house to house.
सर बैकअप माइंड आपको ये डर था कि ये एक ऐसी बीमारी है, मुझे भी खतरा है?
No, वो तो खतरा तो था.
अच्छा.
खतरा तो था.
लेकिन
आपने not only it was with everybody, even all my family members got hepatitis. Everybody got hepatitis. So वो तो खतरा तो था. But then we did data which were unprecedented. We got the field data. So we told the world, no, this is not hospital data now. These are the data actually which happens in the village. And we put it that this is a new disease. But world would not accept it. They said, no, you're speaking wrong. And then you heard that I sent all these serum samples to 8 international labs in the world, and which are now this time like CDC, NIH during COVID में, there's like Abbott laboratory, Japan में there are 2 laboratories which are very, and then Netherlands. There are big laboratories now who really carry the world research. I sent to them. It was not easy to send that sample at -90. I had to find first -90 cans. It's a can which is about 3 feet. The only can this happens was in the veterinary, because they were जब sperm करते हैं ना ये it was just started, and it was in Gandharbal में there's an institute, and they had those huge cans -90. We had to keep the samples and send outside the world. Huge costs, and huge efforts. And I had to get those canes of -90, put blood samples there and stool samples and sent to these labs. And all the labs said this is a new disease. This is just not what is known up to this time. So it was stamping was from them. Shouting was from me, but it was a shout which was not accepted. But then they said, "Oh, this is new disease," and then I had the data. And once I had the new disease, I was asked to go to every country in the world. I spent time practically in every country in the world after those few years. And the main country was US, obviously, in Washington, D.C., in NIH. NIH देखते हैं. Several things. We started working with NIH. But then so many things happened. There was a similar epidemic was in Afghanistan. Afghanistan, which was Soviet soldiers there. 600,000 soldiers, 110,000 soldiers developed hepatitis. Out of 6,000 Soviet soldiers who were fighting for Soviet, Afghanistan, that is the fight. You know that. Afghanistan was under Soviet. Out of 600,000, 100,000, 1,10,000 लोगों को हेपेटाइटिस हुआ. यहाँ पर तो यहाँ तो फर्स्ट टाइम इट वेंट 20,083. That was the first epidemic. But total was 57,000. Total all the epidemics. There were 10 in
Kashmir only you're talking about.
A few in Jammu also. 2-3 तो जम्मू में हुए.
किसी की मौत भी हुई थी हेपेटाइटिस से उस टाइम?
The first epidemic caused 600 deaths. 450 women died. The first epidemic. And out of 58,000, 1,700 deaths. And 1,200 pregnant women.
ज़्यादा उन पे ही असर करता था.
That's right. So
now vaccine is available for hepatitis.
It just has come. I just wrote a paper yesterday on vaccine on a consensus report. I completed it, sent it to the journal. The vaccine is available now in your market.
तब उन पेशेंट्स को क्या करते थे आप जिनको हेपेटाइटिस होता था?
They just support you. Till yesterday they all support you treatment. There was no antiviral.
I said no.
Except one.
Like COVID. It was like
COVID. Yeah, that's right.
सही से. So now vaccine is available.
Now vaccine is for prevention, not for treatment. For prevention. Treatment के लिए you don't have an antiviral drug yet. No.
It's a waterborne disease, right?
Waterborne, and it's waterborne here, but in the West was saying that this is not here. They have more hepatitis C than us. But that hepatitis is genotype 2 and 3 and 4. But that happens from swine to humans. Hepatitis here happens from human to humans. From human to human through water.
Main reason ये इसका water.
But in West it happens from swine because you take pig's liver they take. They take the sausage. It's called a figurello sausage. I don't know whether you know in France. That is a raw liver of pig. Raw. Packed in the sausage.
Right.
It's not cooked. And you take it like goshtava.
They eat it to
because every pig on this universe is infected with hepatitis C. There are 12 animal species now which are infected heavily with hepatitis C.
यहाँ भी है कोई ऐसा animal like
every pig here. यहाँ पर boars बहुत हैं. आपके जहाँ पर रहते हैं जहाँ से आप रहते हैं, तुम्हारे जंगल में boar. You know the story who brought the boar here?
इस तरह भी सुना है मैंने. नहीं
सुना. I think you should read about that. You should make a story sometimes of boars of Kashmir. That is a wild pig.
wild pig.
A boar is a wild pig.
जम्मू में तो मैंने देखा वो तो
no pig वो तो वहाँ pig भी होते हैं. यहाँ पर pig नहीं. यहाँ पर boars
है.
Which is a bigger animal and is a wild boar, a wild pig. Now fish is avian.
Fish is
chicken. there are chicken, if you get hepatitis C in the chicken, it completely takes off the herd.
अच्छा.
It just it wipes the herd.
Okay.
You get a liver disease in them. इसी तरह pig, camel, okay.
और चिकन आपने मेन
rat,
कहा इसमें. हाँ.
rat is heavily infected with hepatitis C.
अच्छा.
And so there's over 12 species.
ह्यूमन में ये फैल सकता है इन सब चीजों.
Human is another. Human gets genotype 1 and 2 here, and 3 and 4 in West.
अच्छा.
That's a huge story now. It has come up.
लेकिन वाटर की बात करी आपने तो लोग इस पे बहुत कंसर्न है लोगों का, क्या ये बॉयल पीना है, क्या आरओ का पीना है, तो
I don't think that matters. I think what has happened, something remarkable has happened, and that is what should have happened. On 2nd June 2014, Prime Minister of India went and started a scheme, Switch Bharat Abhiyan. You know the scheme? Yeah, that started on 2nd June 2014.
Prime Minister Modi started it actually.
He himself did.
Exactly.
And I wrote an article on that.
Achha.
On that, I wrote a big editorial of how will be its importance. I wrote it that time. Now, what India was most famous for in the West, there was one thing which India was famous for. That is open defecation.
Achha.
That you go in the morning, take a lota, and go to the field, ease yourself, and come back. So that is what Western people would call India as. It's an open defecation factory. But this scheme, which Prime Minister started, now it has gone through phase 1 and phase 2. It has remarkably changed India.
Achha.
And the defecation is gone. The latrines, which was the sanitation, which was less than 40%, is now 99%.
Achha.
And because of that, water normally is clean, but it gets infected with fecal matter. So if you improve the sanitation, you improve water supplies. You can never improve water supplies if you don't improve the
sanitization. Exactly.
So you might tell me, hey, just it can never happen unless what happens inside the city, that there are drains which are going open drains. Water can never be safe. Never. It doesn't happen.
But
exactly. How will it get polluted?
When there are open drains around it. Exactly.
And then the water pipes, they have a small, the whole fecal matter. So you can never have, and that's what the Prime Minister of India probably, I think somebody very important epidemiologist told him. And this I had been writing for years together.
Achha.
That please don't think of clean water, think of better sanitation. That what disposal you take, particularly from the latrines, that should be disposed properly. And that's what happened with this Abhiyan scheme, the sanitation scheme. Now, it changed the concept of sanitation. I know the whole world is actually appreciating it. If you look at this, they have one problem yet, the groundwater. The groundwater, they cannot manage because it's a much bigger project. That is in this phase 2. The sanitation they have controlled quite a bit. It is, at least the data show that sanitation is controlled. But also, you have to improve the groundwater. You see, after a while from you get that drinking water. It's your groundwater.
Exactly.
So if your groundwater is not clean, you can't get clean water. So please
how can we clean it?
No, see, I'll tell you what happens. If you go and defecate in the open area, it gets into the groundwater. So whatever is on the surface, that will go to the groundwater, and that will pollute your groundwater. And once your groundwater is polluted, This is something very interesting. Although I deal with
it's
it
interesting
differently.
sir, it's very interesting
It goes
and
into
it's a concern even, मतलब लोग तो जानना चाहते हैं ना कि भाई क्या पानी हम सेफ है जो पीते हैं। ये जो आप इसमें थोड़ा क्लैरिटी दे रहे हैं तो ये इससे थोड़ा आइडिया मिल
yeah.
जाएगा।
This is something important for a state like J&K or UP or this thing. What is important is the sanitation should be better, and I think we should improve our groundwater.
Sir, do you think
Groundwater,
that
they have
we
not
have better sanitation here in
much better than what it was when the
way?
epidemic
अच्छा
came.
अच्छा अच्छा
That time it was we were taking from open Ningli Nala, and हर एक घर में लैट्रिन होती थी वो नींगली नाले पर होती थी,
सही
and then you would ease yourself there, and here you would take that water.
that water
How is it possible that
सही
it
सही
just cannot be clean?
सही
If you take those latrins off, don't pollute it, and do a proper sanitation, the water you get is clean. It's very simple. It's not and now if you continue polluting that, you might boil it, you might use chlorine, you might use anything. It's not effective. Effective is
इवन बॉइलिंग के बाद भी नहीं।
how can you
हाँ
you go in the morning,
बिल्कुल बिल्कुल मैं समझ
you use your toothbrush, आप टेप से लगाते हो टूथब्रश
हाँ
you know how Westerners when they come here how they get hepatitis C? They don't get, they take this water.
अच्छा
They take but yet they get hepatitis C. I'll tell you how they get it. In the morning they go to the washroom
देना
and
सही उनमें मुंह में पानी
they do a brush.
हाँ
Not only they put hepatitis C into their gums.
सही सही
It's just not possible unless you do a better sanitation. You can't. And now the hepatitis C is coming down.
It's coming down.
There's no doubt. It has made a lot of impact.
आज भी पेशेंट्स आते हैं
आते हैं, but this was a major killer. But now the impact has come down. जैसे आपने कोविड में देखा, with the vaccine, how much it had happened. Similarly with this water, it has had a significant impact. And there's only one scheme which started in 2014. And I think that just when this government came, they started this whole process.
Sir, cancer cases are rising in Kashmir actually. So what is the reason behind this? हम देख रहे हैं कि चाहे वो गैस्ट्रो के हैं, चाहे वो गट के हैं, चाहे दूसरी जो कैंसर यहाँ पे अभी डिटेक्ट हो रहे हैं, तो क्या रीजन है सर, क्या वजह है इस पे?
I'll tell you there are several things which we have. The actual data actually are not available.
अच्छा.
The actual data you have to have cancer registry. वो तो है ही नहीं.
ठीक.
And this cancer registry has to be a population cancer registry. यहाँ पर क्या होता है, इंस्टीट्यूट में एक कैंसर रजिस्ट्री है. They register patients who come to the institute.
सही.
That is not cancer.
फिर वही फिगर हमारे सामने आता है.
आता है. Or there may be a cancer registry in the SMHS. That is a highly selective group of cancers. But let's forget about that. So you don't have a population-based cancer registry yet. They are started now in India. There are few attempts, but abhi to we have not been successful like in West. There we know every patient anywhere who has a cancer is detected because the registry is population-based.
Achha.
But forget about that. But there is no doubt that there is a scare of cancer. I'll tell you why it is high. First thing is, जो पहले कैंसर सबसे होता था यहाँ, that was food pipe and stomach, and we are known for that. ये दो कैंसर तो पहले से ही, that's one.
Was there any particular reason for this?
I'll tell you the reason. I'll tell you the reason for everything, and for all the reasons. We have done extensive work on esophageal cancer. Extensive. Now it did not come to the surface. It is published. But we have not given the last thing that there were 3 centers which were working when I was in the institute. There was the Institute of Medical Sciences, Sher Kashmir Institute. There was the University of Kashmir, and there was a cancer society in Lyon, in Europe.
Achha.
So 3 of the groups were working, and we worked for about 10 years. And we came nearly to understanding that esophageal cancer is high. It is one of the highest in the world in Kashmir.
अच्छा
We did population-based studies. Second, we found that all the foods we take have nitrosamines, very
अच्छा
high level, particularly foods when we dry them.
अच्छा ड्राई देम अच्छा
Dried
वो वाले फ्रूट
vegetables,
सही है
dried hogarishna
हाँ
asana.
सुषमा अगर कल्चर है सब तो खाते हैं
No,
हम्म,
that is what. So second is, but the most important is, if you take Kashmiri tea
हाँ
and boil it and go on boiling it and put salt, it gives you two carcinogens we identified in extraordinary high levels. So we were really ready to explore this news. The first thing what happened, the Leon people disappeared.
अच्छा
89.
ठीक
You know why
हाँ हाँ
89? Why they
सही सही
disappeared?
सही हाँ मैं आई गॉट
So
इट हाँ
वो तो I
हम्म,
told him, वो कहाँ जा रहे हो आप?
सही सही
No, please leave
हमें
us.
बाकी दो हमें
We
रिसर्च
can't
नहीं
do
कर
here. So then Dr. Siddiqui was in university. He was very good. So he also left.
अच्छा
तो मैंने कहा डॉक्टर सिद्दीकी कहाँ जा रहे हो? कहता मुझे मरना है.
सही
I'm leaving.
हाँ हाँ सही
So then I also left.
हम्म।
Oh, I told you the story.
हाँ हाँ बिल्कुल बिल्कुल
So the story is hidden there. Nobody has ever gone beyond that. Nobody had the guts to find out why esophageal cancer. We know what it is. It is because foods. Stomach cancer is related to one thing only, H. pylori.
एच
H. pylori is class 1 carcinogen, जो stomach से gastric, and it is rampant here.
हाँ मैं एक देख रहा था आपका आपने 60% बोला था कि लोगों को
It
ये
is
है
rampant here, and that's why gastric cancer is common. Now, lung cancer. Lung cancer is common. You take hookah, you take cigarettes.
हाँ
So it is coming up. Now there are other cancers like thyroid cancer is very common
ओके
because radioactivity in the atmosphere is very high. It goes with radioactivity. जहाँ पर just like after Hiroshima and Nagasaki, or after when there was a leak in Russia about some of these thyroid cancer gets very common. See, it happens with the radiation. इसी तरह lymphomas became also common because of the same thing. And there are some genetic disorder also which can give cancer, like liver cancer is coming up, pancreatic cancer is coming up, bone cancers are common. Now you might say why we are talking too much about it. First thing is the detection is higher. Every cancer goes from plain X-ray, plain radiology to PET scan. वो कहाँ होता था? When there were doctors earlier,
हाँ सही
they patient would have a cancer, they would not know about him.
हाँ सही
No, because for a gastric cancer you have to do an endoscopy. Endoscopy थी नहीं.
थी नहीं
For a gastric, for a lung cancer you need a bronchoscopy. वो तो थी उस वक्त तो metric tube होता था. वो पोजीशन नहीं थी उधर. इसी तरह other cancers they were not detected. So detection rate is high. Second thing is our age has gone up. After all, cancer comes up when you live much more than you were. Our age was already 50 or 45 before. Now the average age for Indian is about 70. It might even go to 75. It's a remarkable change. So if you live 20 years more, everybody lives 20 years more on an average. So the cancers will come up. So detection has been high. And then exposure to carcinogens also has increased. And at least in Kashmir, it is mainly because of the fruit industry and from agriculture.
अच्छा
We are using so many fertilizers, and all of them are carcinogens. Any fertilizer you use for your fruit, for your taking hawk and ruangan and other things, use fertilizers. They contain carcinogens. They contain nitrates and nitrosamines. And they are very strong
तो
carcinogens.
खाएं क्या डॉक्टर साहब यहाँ तो ये सवाल तो मेरे सामने
No,
नहीं
no,
पूछ
खाने तो you cannot do it. It's not your problem.
हाँ
It cannot
Full
be
stop
done. It is not. No, it
गवर्नमेंट शुड
can't be
स्टॉप
done on individual level.
हाँ
जैसे मैंने वाटर का बोला, आप कहते हैं वाटर बॉयल करो,
हाँ हाँ
तो आप टूथब्रश को क्या करोगे?
क्या करेंगे बिल्कुल
Unless the government gives, unless the scheme is there for a good sanitation,
हाँ हाँ
you can't get proper
एक
water.
स्कीम आई तो सैनिटेशन थोड़ा ठीक हो
Oh,
गया
there's no
हाँ
doubt.
हाँ हाँ
Yeah. इसी तरह there has to be a transformation that you don't use so many fertilizers. As long as and you cannot avoid taking uh, carcinogens. After all, everything you are taking on your plate has come through a process, and
सही
fertilizer has been used for that.
हम्म
Now, uh, so that's why cancers are common. But this cannot be, you cannot say कि मैं ये avoid करूँगा तो मुझे कैंसर नहीं हो जाएगा या ये खाऊंगा तो कैंसर हो जाएगा. No, it has to have a nationwide scheme. Somebody else has to come, like the Prime Minister who came in 2014 about water supply. He understood it very well. Somebody has to come up, oh, okay, we should reduce the fertilizers or using anything which has a carcinogenic effect, which is a huge, it would make a huge impact, but it will take about 50 years for it to, if we started today, it will take 50 years for it to start running. So, if somebody tells you, just take a fresh vegetable, take this thing, take that thing, he's cheating you.
सही है
Is because this
हाँ हाँ
this fresh vegetable has come from a field where there has been a fertilizer.
फर्टिलाइजर हाँ
No fresh vegetable will come from, or there's a fruit.
हाँ वो तो
कितने कितने बार आप वो दवाई लगाते हो? तीन
हाँ
चार बार.
3-4 बार
Because
सही
otherwise नहीं लगा तो fungus होगा.
हाँ फंगस
He
होगा
will
हाँ
lose everything, poor man.
सही
So he
सही
has to use a
इवन
fertilizer.
यहाँ का लोकल फ्रूट वो भी वैसा ही है लोकल
Exactly, it's
हाँ
worse.
हाँ हाँ
Everywhere, not only here, it's all over.
इट्स ऑल हुआ
But then some countries like Europe have
adopted some
adopted very strict policies, and that's how. So this is another way. That's why cancer has become common. So it has become common that there are, we already were high risk for cancer, like esophagus, stomach, and lung. Hookah jo tha, the smoking is a very important factor. Second thing is age has become more, detection has become more,
बट
and
यंग
we are
पीपल
using
आर वी आर
fertilizer.
सीइंग कि छोटे छोटे जो है हमारे लोग उनमें अब कैंसर पाया जाता है कोई चीज अवॉइड कर सकते हैं जैसे नुन चाय पे परसों यहाँ बहुत डिस्कशन चला कि इसमें सोडियम है इससे कैंसर आपने ये अभी जिक्र भी किया कि इससे कैंसर होने के चांसेस हैं क्या ये अवॉइड कर सकते हैं हम देखते हैं कि 5-5 कप भी हम हमारे कश्मीरी लोग हमारे कश्मीरी
We did a study, we showed, it was published in published in one of the very important journals, that cancer esophagus is highest in Kashmir. And if you take more than 2 cups of Kashmiri tea,
in a day,
cancer every day, the cancer level rises. And then there are some regions like in South Kashmir where it was more than in North Kashmir. And then in some religions, it was more, it's an extensive study. And in some religions, it was more than other religions. It had ethnic background also. That might be because of their genetics or whatever it is. So
what is your advice to the people actually? They want to know from you, sir. Actually, इस पे कोई थोड़ी advice आपने कहा बहुत चीजें हैं इसमें stop नहीं कर सकते हैं लेकिन कम तो कर सकते हैं चाय जैसे चाय की ही
No, there's no doubt. The first thing which would make an impact on cancer is if you stop smoking. That is fundamental. That is fundamental that you must stop because that is class 1 carcinogen and number 1 cause of lung cancer. Majority of the lung cancers are related to smoking. So we must stop smoking. And even ex-smokers, the chances of cancer go down. That's number 1. Second thing is anything which is a strong carcinogen, like large amounts of Kashmiri tea, you must reduce it. Third, if you take excess of fat, Waazwan chuti khawan, there is a marriage here, you take 8 times Waazwan. Every day you take 30-40,000 calories in one trami, 40,000 calories. So obesity, diabetes,
that is very common,
hypertension, and gout, and
fatty
cancers,
liver, even
fatty liver, and cancers. It causes high level of colon cancer. It causes high level of pancreatic cancer. So best thing is to make your diet which appropriate. Now fertilizers you cannot avoid, but then it has to go through a system. But if you take fresher vegetables, And if you don't dried vegetables, so avoid carrying a dried fish. Fish is very good for health, excellent.
Excellent.
But then if you take a dried fish, you are particularly salted. जैसे जापान में the commonest cause of stomach cancer was they were taking salted dry fish,
अच्छा,
and that they could even keep preserved for 4 years, 5 years.
ओके,
You
ठीक।
take a fish,
हाँ, हाँ, सही,
dry
सही।
it, and put a salt
हाँ,
in
हाँ।
that. It
Better is
stay,
to cook, you mean to say, ना?
no, fresh.
अच्छा, fresh, okay.
Right. Don't take dried vegetables.
अच्छा।
Don't take dried because that also is a factor which we have found out.
हम्म,
And excess of fats is another thing. And then always, always there are some cancers which can be prevented.
okay.
And West has shown it perfectly. The first cancer they have prevented is colon cancer.
Colon cancer.
They do regular colonoscopies above 50, and if you have a polyp, take it out. Because colon cancer does not come just like colon cancer. No. Colon cancer comes a polyp,
हाँ,
goes more than 1
हाँ,
centimeter,
हाँ।
then becomes a cancer. So what in West they are doing colonoscopies and taking the polyps
But
out.
people are not ready here for colonoscopy and these,
I'm
tests.
telling you, this is what has happened in the West.
हाँ, सही,
Second cancer, which is most important to prevent, is breast cancer.
सही,
First thing is every lady must palpate her own breast.
okay.
She doesn't need to come to my clinic.
हम्म,
She has to palpate her own breast. कोई lump तो नहीं है. If she doesn't have a lump, and palpate it not like this, palpate it like this. I showed you how to palpate.
अच्छा,
Every woman must palpate it like this and like this.
सही,
And then at an age around above 40, do mammograms. They're excellent to pick up breast cancer.
breast cancer.
Then one of the major problem which has been solved in India is cervical. Cervical cancer is very common in India.
अच्छा, अच्छा,
It is not as common in Kashmir as in rest of the country. I'll tell you the reason. The pap smear is essential to do for every lady. Above a particular age, give a pap smear. You do a swab of the cervix and look for, and some of the people in like PGI and other people, they're not wonderful work and world renowned how to reduce the chances of cervical cancer. These are several cancers, and there are others I don't want to, but there's one more thing I wanted to tell you. These are cancers which were surveillance, these are called surveillance. Colon cancer, breast cancer, cervical cancer, even thyroid you can pick up, although it is difficult. And H. pylori for stomach you can pick up, and routine sort of checkup. But there's one thing very important which has come up. I don't know whether you know it or not. The HPV vaccine. You heard the Prime Minister started it. The papilloma virus is the cause of cervical cancer.
अच्छा,
The cervical cancer is caused by a human papilloma virus.
ठीक,
And every girl between 7 to 12 must get a papilloma HPV vaccine.
सही,
It's a nationwide, it's free available now, 3
अच्छा,
doses.
अच्छा,
It's free everywhere.
हम्म,
And the government of India started it. These girls are protected from a cervical cancer, which is very common cancer in females. A very common cancer. So
तो इसमें कोई अवेयरनेस तो मुझे लगता है नहीं।
मैं बता रहा हूँ, अब ये तो अब प्राइम मिनिस्टर हिमसेल्फ आपको पता नहीं मैं क्या करूँ।
उन्होंने किया है, मैं यहाँ की बात कर रहा हूँ।
No, but he started a nationwide scheme.
हाँ,
and he said
तो यहाँ इम्प्लीमेंट हुई है आपको लगता है? अच्छा, अच्छा,
everywhere.
अच्छा, अच्छा, होता है ये वैक्सीन होता है।
HPV vaccine is available now. Although when I got it for my family, I paid for it. That was a few years back. But now I think this came last year. And hepatitis B vaccine, very important. And other vaccines. Hepatitis B vaccine prevents liver cancer. See? So if I say, if you have to control cancer, first understand why it is so. Second, cancerous things you avoid. I told you which are definitely known, like smoking.
हाँ हाँ, जो चीजें आपने
जो
कही, हाँ हाँ
and second thing, do surveillance. I told you
हाँ बिल्कुल,
that is to be done at a particular age,
हाँ हाँ,
and use vaccines.
यूज वैक्सीन और टेस्ट वगैरह जो अर्ली
No,
जैसे,
that is surveillance.
अच्छा दैट इज दैट्स
That
कॉल्ड
is
सर,
that comes surveillance comes. There are only few cancers which can be protected by surveillance. The most important is breast cancer in the females, cervical cancer in the females, colon cancer all over above 50 years, and few like prostate cancer by doing a PSA. There are several. Doctors know it. I don't want to give you the big lesson on that,
हाँ
but this
सही,
is something which is and then use vaccine like HPV
नहीं
vaccine.
सर डॉक्टर्स ही तो जानते हैं, लोग तो जानते नहीं है, लोग टेस्ट करने के लिए तैयार ही नहीं है। एक छोटी सी बीमारी किसी को होती है वो इग्नोर करते हैं। मैं आपकी कोलोनोस्कोपी की बात जो कर रहा था, कोई तैयार ही नहीं है, डर है भाई, डर है, कोलोनोस्कोपी होनी है, छोड़ दो, लीव इट, बीमारी है तो चल रही।
In West,
यहाँ
you
यही
will
लग
not
रहा
find a human being above 50
है।
in US who has not had a surveillance
सर्विलांस, हाँ सही।
or who has not had
ये एक
colonoscopy.
इम्पोर्टेंट पॉइंट है सर, मैं पता है इस पे जोर क्यों दे रहा हूँ, क्योंकि लोग इसके लिए तैयार नहीं है। सर्विलांस आप कह रहे हैं, डॉक्टर्स तो कहते हैं मगर अवॉइड करते हैं लोग।
Or HPV, your hemopap, this vaccine is very important. Doing a pap smear is very important. Doing a PSA in males is important above a particular age because prostate cancer is very common. You have seen many of your people said that they have prostate cancer. You can prevent it. Or you can protect yourself. Pick it early when it is treatable.
Yeah, it is treatable. That is what I mean to say actually. तब इसको पिक करना इम्पोर्टेंट है।
And smoking is very important.
हाँ हाँ सर, वो अर्ली जो साइन है डाइजेस्टिव आपका कोई सिस्टम खराब है, जब आपको डॉक्टर को जाना है, जब आपको टेस्ट करने हैं, क्या कहेंगे सर सामीन को किस तरह?
No, you see, dyspepsia is so common. Dyspepsia, it's not common here. It's common all over the world. And it has three basic causes. Which is not only here, which is all over, but in different proportions. The commonest cause is H. pylori.
H. pylori.
Because it causes, and it starts at 3 years in life. And stays whole life.
Same.
So you can see a bacteria stays from your 3 years to whole life. What can it do to the stomach? Because gastritis, duodenal ulcer, gastric cancer, lymphoma, it causes all the things. So that is one. So that is one cause of dyspepsia. Second cause of dyspepsia is reflux. That acid goes from the stomach to the food pipe. It's a very common disease. It's not because of hernia or anything, because the lower acetabular sphincter is dysfunction. That's a very complex sphincter. जो sphincter between food pipe और stomach में होता है, that opening, is a very complex structure.
Because of that reflex.
No, it dysfunctions. Normally, it should protect you from acid should not go into the food pipe. But because it dysfunctions, it doesn't function properly. It is a very common thing, and the acid goes up in the so we call it GERD or reflux. The third common cause is the commonest. What is going on today? Your stress in life. You want to catch up to your work. You want to earn your money. You want to feed your family. This stress causes dyspepsia. So there are three basic causes of dyspepsia. And when somebody comes to me, I have to segregate. If you knew it, the doctors were called gods and other things. They have no idea about all this. So अब तो वो लिखते थे antacid. Antacid. I yet write it, but they would keep antacids for years. But now we have to find out whether this patient has H. pylori, whether he has a reflux, or whether it's a stress-related dyspepsia. And and this is intractable disease.
Stress कैसे कम करें सर? Stress तो आप सारे लेते हैं, ये तो बड़ा problem बना है.
Stress is normal. If you are after all you have, it's something. And then not only stress, people take stress at different levels. Some people are very, very conscious
about everything.
About everything.
Exactly.
Some people just don't bother. So that's why about 15% people have dyspepsia.
सही सर, लिवर, अब यहाँ फैटी लिवर मैं अक्सर देखता हूँ, हर किसी को फैटी लिवर है, क्या रीजन है सर, क्यों बढ़ रहा है? क्या ये मतलब एक्टिविटी सही नहीं है?
When I left Kashmir, that was 96, I had an ultrasound, in the department. I never saw fatty liver
अच्छा,
because we were doing ultrasound right and left. That was very early. We bought ultrasound in institute. It was one of the first in the country we bought ultrasound here. Probably there were two ultrasounds, one in Bombay and somewhere else, and we bought in the institute. It was a Japanese local ultrasound, and we were doing right and left. We never saw fatty liver.
अच्छा,
When I came back, in the first 1 week, I didn't see anything except fatty liver.
अच्छा, अच्छा।
Only between 10 years had happened.
इन बिटवीन क्या हो गया सर इतना?
वो तो मैं बता
हाँ,
दूंगा ना. I'll tell you what happened. So I had a nursing when I came back in 2006, 2007. So I got one of my assistants who was a nurse. मैंने कहा कुछ करना है. कहते क्या बात है? What is going on? So I said let's go and go down to the Waazwans. उसने कहा मैंने क्या करना Waazwan? मैंने कुछ नहीं करना.
अच्छा,
We have to identify what is cooked in Waazwan. And when it is served, what is the calories served? And how much is fat, carbohydrate, and proteins? After about 6 months, we were shocked that when you serve one trami,
सही,
you serve 40,000 calories.
ह्यूज,
Normally, you should be able to take 1,200 calories if you are normal. And if you are a laborer, you take 1,800. Beyond 1,800, it is a sin to take more than 1,800. And that also you have to see fat, kitna hai, carbohydrate, kitna hai.
सही,
So between a laborer and a sedentary worker takes 600. A person like you and me should take 1,200 calories. And a person who is real laborer, jo mazdoor hai, 1,800. This was 40,000 calories in one trami. So you take 10,000 one time. And you don't take it one time if you have a khandar or something. You take it 6 times. So we were surprised. I was shocked. I just felt unconscious. Okay, what is going on?
सही,
Because I went to a friend of mine who remarried in Pulwama. So we went there at about 8 o'clock. We were started serving at 9. And the last dish was served when there was a morning prayer.
सही,
And
आज की डेट में भी
we
है सर?
counted 32 servings were done. And all of us were sleeping.
अच्छा, सही, सही,
So then I wrote this story. And the head of the Waazwan of Kashmir, he came to my home. He was from Batmalu at that time. He came to my home. He says, I would want to talk to you. So मैंने कहा गए अब now all this water they not near me.
अच्छा,
So
अच्छा,
I knew him.
सही,
His name was Glanabi. So
सही,
that time was many years back. So he came to my home. I told him, what can I do for you? He says, you have written an article in Greater Kashmir. हमने उसको उर्दू तर्जमा किया और हमने पढ़ा. आपने लिखा है कि हर तामी में 40,000 कैलोरीज होते हैं. मैंने कहा मैंने कहा I'm very sorry. कहते नहीं sorry नहीं. I will tell you the story.
अच्छा, अच्छा,
He says we are telling everybody, please, Waazwan is 4 dishes. Don't go beyond that. It's pleasure to have 4 dishes. Nobody कोई
नहीं
मानता नहीं.
आज तो ऐड कर रहे हैं सर.
तो मैंने उसने बोला कि मैं उधर पुलवामा में he gave a story that there was a party. किसी लड़की की शादी थी. उसकी शादी नहीं मंगनी थी. तो उन्होंने घर वालों ने उनको दूसरे जो आए थे गेस्ट उनको दूसरे फर्स्ट फ्लोर पर चढ़ाया और बाकी को नीचे दिया. हर एक रिश्ते में प्रमुख सुन पूर्ण.
हाँ सर, ये तो आप कहा हमने भी बहुत.
You know what happened? He told me this. I had never heard about it. He told me this story. He said, now I was cooking that time. I told him this is ये गुनाह है. तो जब उनने फिर वहाँ से उनको बोला कि आप ये खोलो और gold coin निकालो, one person got up from the guest. He said, "We are not going to marry in this house. This is against religion. This is against ethics. This is against all norms." And they moved out. और ये उसने कहा ये भी हुआ. But then, so fatty liver is a result of what we eat,
frustration, I can say, sir.
what we eat, and how much, and then everybody is a car.
हाँ.
अगर आप इमराकल जाओगे 2 घंटे लग जाएंगे आपको पहुंचने में.
सही है.
Earlier we could walk.
हाँ.
Every day I would use a bicycle from the hostel to the medical college, and even in the institute. During this time in 90s, I would go in a bicycle or go in a foot.
हाँ, बिल्कुल.
Now you think you will go to institute on foot?
नहीं, possible ही नहीं है. बाहर मार्केट जाना है, गाड़ी लेके जाना है. वो तो उसमें
बाहर जाओ आधा किलोमीटर तक. यहाँ मैं आया, actually my home is only 1 kilometer. My vehicle is outside. सही. ये sin है. I should have walked here. It would have been a pleasure. You don't walk. अभी mosque में भी पता नहीं है. Mosque अब तो ठीक है. वो आधे किलोमीटर थी. अब मॉस्क मेरे घर के बाहर है.
सर, अगर कोई एडवाइस आप देना चाहेंगे फैटी लिवर कम करने के लिए तो क्या?
Keep your weight. The most important is keep your weight in balance.
अच्छा, weight balance.
You have a BMI of 23. Don't get it more, and be as active in life as you can. If you want to go to a mosque, go to distant mosque. अब बाहर न जाओ जो घर के बाहर आपने बनाई. मैंने भी एक घर के बाहर ही बनाई मॉस्क और 32 ऑफिसेस वो बाहर बनाई. सिम थोड़ा मैं दूर जाता, जामा मस्जिद जाता, और मे बी आई कुड गो टू हजरतपुर में एक ही दफा गया. बिफोर आई वुड गो आई वुड वॉक फ्रॉम एसएमएच. आई वुड वॉक. मैं हजरतपुर जाता था. अब मैं गाड़ी में जाता हूँ मे बी once in 10 years or once in this thing. So you have to cut down on your these facilities. You be active, you walk, you reduce your intake. There's nothing wrong taking Waazwan, but then 4 dishes are enough. You don't take 20 dishes, 30 dishes, and you would love taking 4 dishes. अगर आप लेंगे 4 जो Waazwan के हैं, they are fantastic, and you will never overeat.
सही.
But
रेड मीट भी घर में अक्सर तो पकता ही है यहाँ हमारे घरों में. वो भी एक कंसर्न.
That is also another way of meat की consumption. देखो how much is the meat consumption. Oil की consumption है tremendous, and we don't take vegetables. मैं श्योर दूध कर रहा. मैं सारी पेश माना क्यों मैं श्योर दूध कर रहा. I can't do without meat. Because we have grown like that. We can't do without meat. Even I can't do that also. It's not. I don't. If you're starting vegetable, we are not like other Indians. मिठाई शने ज़्यादा खावा की. गुजरातन च fatty liver तिम च खाली मिठाई खावा. But ये चीज़ वो मांस खावा तो भाई चर्बी खावा. So it's different.
White meat is recommendable. अगर white meat.
Chicken is reasonably safe. Fish would have been the best. Fish is very good. Mediterranean diet is wonderful. That is, if that diet comes into our culture, what's called a Mediterranean diet, that is wonderful.
अच्छा.
That is highly protective against all human illnesses. What is in the Mediterranean, and I think people should understand what is Mediterranean diet. What are the? It's not difficult to inculcate it here and reduce our diet here, which is our culture diet.
सर, हेल्थ सेक्टर को कैसे देखते हैं जम्मू एंड कश्मीर में? क्योंकि अब बहुत इनिशिएटिव्स लिए गए हैं सरकार की तरफ से. प्राइम मिनिस्टर इसमें सीरियस है. हमारी सरकार हेल्थ सेक्टर पे काम करे. डू यू थिंक कि हमारा हेल्थ सेक्टर उस लेवल का है कि आप बाहर जाने की जरूरत नहीं है?
No. बाहर जाने की बात दूसरी है, but health sector has expanded. There's no doubt, and it has improved. There's no doubt. And what was when I was a medical student or a resident, there was transformation of health. There's no doubt. And this transformation can be, in India at least, it can be compared with any other state. Now, you are only depend on SMHs. सोच बेचारा इन बनोमत had one someone was बनोमत, and everybody was, and he was very happy.
Say.
The problem was that nobody understood the disease. Nobody knew what cancer is. Nobody diagnosed cancer. Not that they were inefficient. They didn't have means to do that. A doctor at that age, nobody diagnosed anything.
Say.
He could never diagnose gastric cancer, esophageal cancer,
there was no technology.
Because there's no technology. We have to be fair to them. But that's what it was.
It was.
Or heart disease.
Now it has completely changed.
It has so that is one. Second thing is, now from SMHS you can see how many hospitals. Even in the city you will have about 50 hospitals where you can be proud of.
Exactly.
They are private. Go from there, and they are good hospitals. They have a tertiary care there. Then government hospitals. Even you see Gausia, you see somewhere everywhere. There are hospitals. And see it all over the state. That's number one. The technology has improved. Everywhere you see ultrasounds, you see endoscopies, you see cath labs, you see, so technology. Doctors have improved, and doctors are available. A Handwara person or a person from, let's say, Shupian, if he had a heart disease or a abdominal problem or appendix, this is now diagnosed there. Earlier he had to come to SMHS, and you can see how much transformations happened, and manpower has increased. You can see how many DMs are there. Like when I was there, we were the first to start. After the medical college started MD medicine, that was in '93. Now institute must have put MDs and DMs in hundreds, and they're all over the place. In every department, gastroenterology, cardiology.
Now it has improved actually.
So you cannot say that it has not. It has, and then the people's expectations worsened. Now they don't have same. Earlier they were getting nothing, and they were very happy. Now they are getting at least from maybe 50%, 60%, 70%, and they are cursing the doctors, which is wrong. The doctor, let's say I told you about dyspepsia. Earlier they would just give antacids, finished. Now I have to do endoscopy, I have to do H. pylori test, I have to do pH studies, and then I have to use this drug and that drug and that drug. So you can see that earlier I would say so I can does antacids. Now it is a problem. It's a problem for me as well as for the patient. And then patient also is unhappy with me. Now those doctors ये test.
And test थोनम खबर क्या test दवा बाकी.
पाथोनम ये दवा पाथोनम वो दवा में प्रोज़ोल.
ये complaint होती है अक्सर लोग बोलते हैं ये आपकी बात.
But it's wrong.
हाँ.
But they have to understand
and
it.
You have to diagnose.
Like heart disease. How many people have heart disease? They have coronary. They need a stent. Bronchitis stent का साथ.
ना
इसमें Bombay का.
सही.
अगर stent उस पे अंतरावन, Bombay उस पे होगा.
Sir, what about these certain heart attacks? यहाँ पे बहुत young generation है, उसमें हमें देखने को मिल रहा है.
See, one is again. Certain cardiac deaths and certain heart attacks are different. Certain cardiac deaths can happen because of many reasons. But what we are talking about is a coronary artery disease, which is also increased, at least in India, because of diabetes, because of hypertension, because of our excess salt intake, because of sedentary habits. The atherosclerosis in the coronary arteries is increased. So young people need stents, or they need surgery. I've seen some of my colleagues. There was one of his students whom I trained in the institute. He went to Jammu to start his practice. He had to do a cabbage because he got a heart attack. And he went to Medicine. That was many years back. I mean, young people get it because of poor habits.
Poor habits.
But certain cardiac deaths can happen not necessarily because of coronary artery disease. There can be many other causes also, which we probably is much more.
Stomach health is very important for everything actually. Huh? Connection hai. There is a
I
connection
think
between.
Now there's a dictum in the world. There's a dictum. Microbiome is the crux to the health. That is not stomach. Microbiome is the bacteria, the healthy bacteria which are in your intestines. They say is the crux to your health, which is called microbiome. And there's so much work being done in Europe and many other countries. In India, some centers were started, that microbiome has a direct connection with the heart, with the brain. It has a direct connection with the heart. It has a direct connection with the liver. It has direct connection with the kidney and your general health. So microbiome, you mentioned this. I didn't want to discuss this, but this is a very important chapter, which people probably may not know. Even doctors also will not be very aware of it. That how much is the work going on the factory of bacteria, healthy bacteria which are in the gut, are most important, essential for health. And everywhere we are showing some connections.
अच्छा एक कनेक्शन तो बनता है इसमें
with the brain, with the heart, with the other.
हाँ सर फाइनल एडवाइस हमारे जो सामीन हैं, जो आपको लोग इस वक्त देख रहे हैं या इस वीडियो में देखेंगे, क्या एडवाइस करेंगे हेल्थ को लेकर?
I don't think I said that health is a complex issue. I already mentioned to keep your health. Other than you might be born unfortunate from a genetic disease or a disease which you have from the family. Other than that, all other diseases are preventable and controllable. Other than what you get from your family. So if you get from your family, then obviously that also has a treatment. So if you maintain your health, is maintain your habits, your activity, your weight, and have a regular checkups right from beginning. It doesn't need to go to every month to a doctor. If you are healthy, probably a young man, every 3 years would be enough. But as soon as you grow old, every year a checkup would be good. And then look for diseases which are preventable. You said about cancer. I told you there's so many other diseases also, like for sugar. It's a very common disease here. Hypertension is so common, so you must control it, and so that is. And then use proper vaccines and preventive measures. And I told you about hepatitis B vaccine. There are some other vaccines also. Now this human papilloma HPV vaccine. It's also अभी तो hepatitis A is coming up, so people should start. And I've seen very sick patients. It's a vaccine is available. So if you have a young girl or boy in your family, if he has not received hepatitis A, please give him. So you protect from a disease which is prevalent now. Similarly, there's different things. I think it's a complex issue that people have to be not fussy about health, but they have to be conscious and do what is right. What is right. And if you are prone to a disorder which is from your family, please take care. That somebody has a familial disorder, then it's very important that you must protect yourself. And there are so many familial disorders which people know it, like hemochromatosis, like Wilson's disease. I'm telling you from gastroenterology.
Yes.
Like these run in the like fibrous disease of the pancreas, which gives a lung disease. It runs in the family, and so many other diseases run the family. And if you know that you have a familial disorder, then you need you go to the person who understands that disease and get protected.
Sir, thanks for this wonderful conversation. Thank you very much for joining us, sir. Thank you, sir.
Thank you very much for inviting me here, and it's been a pleasure talking to you.